back surgery may never be the same again. That should come as welcome news to the 86 million Americans suffering from back pain. And it's exactly what Barbara Mapes was waiting to hear. How bad was her pain?
Severe. It was in my lower back on the right side, then it generated all the way to the front of my leg and down to my knee. I was constant sitting down and resting even after 15 minutes of being on my feet.
Like many patients, Barbara suffered in silence.
I didn't want to have the major surgery.
But finally, when the pain became almost unbearable...
Hi, Barbara.
Hi.
How you doing?
Barbara turned to Dr. Robert Watkins, Jr., co-director of the world-renowned Marina Spine Center at Marina Del Rey Hospital in Marina Del Rey, California. She was hoping for relief. Dr. Watkins explains why Barbara was in pain.
You can see this disc right here is wedge-shaped. That's closing down the hole over here where the nerve comes out. Her right L3 nerve is getting pinched as it came out of the spine, causing her pain in the front of the leg.
Barbara needed fusion surgery, something she was afraid of. But this is not your parent or grandparents' fusion surgery. This is DLIF, or direct lateral interbody fusion, and it's truly revolutionary.
It's truly a minimally invasive approach. We just split through muscles on our way down there, but we don't actually take out any muscle or do any significant damage.
That's because surgery is performed through the patient's side, not their back.
We have the patient actually on his side, and the bed breaks right down the middle, which allows us to bend the patient so that his iliac crest, his hip bone, moves out of the way and the ribs move out of the way, and allows us to get access to the spine and make a much smaller incision.
And do much less tissue damage because there are far fewer and far thinner muscles on the side of the body versus the back.
Traditional fusions are we have to go in from the back and we have to split through the muscles in the back, which cause a lot of trauma and cause pain, and long term it can cause less function because of the disturbance of the muscles.
Another advantage, because surgery is done through the side, Dr. Watkins can use a much larger graft. Now, the graft is what's used in place of the diseased disc that's removed during surgery. The smaller graft on the left is what's typically used, but the newer, larger graft on the right, double the size, allows for a dramatically better fusion. It's truly a case where size does matter, and bigger is better.
People really have less pain after the surgery because they have so much stability from this big graft. And then in the middle, it's got this white stuff. It's called a BMP. It's a type of protein that helps stimulate bone growth. And the big graft really restores the normal lordosis, the normal curvature of the spine. That's what allows us to stand up straight. When you lose your lordosis, as we get older, we lose more and more of our lordosis. We get more and more bent forward. By putting these big grafts in from the side, we're able to restore that normal curvature to allow people to stand up straight.
But before the diseased disc is ever removed,
Turn down to 4.
Dr. Watkins uses a nerve monitoring probe to test nearby nerves, which can prevent nerve damage during surgery.
We have sensors down in the legs that if this touches a nerve, it'll trigger the nerve and it'll fire the muscles in the leg, and we can detect that. So this makes the surgery much safer.
A special tube is inserted to actually work through.
And then we can look down through this tube, use the light and the microscopic loops, and look down through the tube and see the disc and do all the work that we need to do down through this tube, using the x-ray to help guide us as to where we are. And we've got these instruments that can pull the disc out. We clean everything off, make it a nice surface, put our graft across, and then get bone to heal across there to make a solid fusion.
Marina Spine Center Medical Director, Dr. Robert Watkins, Sr.
25 years of doing spinal fusion through the chest, abdomen, back, transoral, every type of fusion you can think of, and this is just an excellent improvement on our pre-existing techniques. It's just been a godsend in terms of what we've been able to accomplish. In 25 years of doing spinal surgery, this is a major advance.
So how did Barbara Mapes feel after surgery? Hard to believe, but pain-free.
I never thought I would be rid of this pain just in a 2-day stay at the hospital. I was sore for probably a week or so. Not really pain, just sore. And when the soreness went away, then I was fine. I could do anything. On the 4th day, I went to my daughter's graduation, and I was amazed that I could do that.
Other benefits, a shorter operation, about half the time, fewer days in the hospital, about 2 days instead of 4.
Anybody who needs a fusion from L4 and above, which is almost all the discs that there are, is an ideal candidate for the lateral fusion. It really is very effective at treating both back pain and leg pain.
And remember that smaller scar Dr. Watkins mentioned?
I think my scar is this big, and that's it. Just an inch scar. It's just amazing. I never expected it to be this good.